Hey, everybody, welcome back to Rational Conversations. Today, we have a very special guest for whom I have been waiting for 2 years, over 2 years now, actually. And we're going to be talking about the pseudoscience in mental health and therapy and a lot more as well. I have a lot to uncover. So let's get into it right after this. Hey everyone, welcome back to Rational Conversations. Today we have with us Cara Santa Maria. Hi, how do you pronounce your name first?
So here in the US, I say Cara, but I always give a pass to folks for whom Cara is awkward in like their languages. So a lot of my British friends, my Australian friends, they might call me Cara. I
Oh,
have a
wonderful.
friend from Rwanda who I think I'm Kira to him.
Oh, that's a little weird. But yeah, with me, my name is Abhijit, and well, the whole world pronounces it in many different ways. So I know exactly how that is. So, Cara,
Yeah.
it is. Thank you so much for joining us.
Thanks for having me.
And I really wanted to jump in and first ask you, what have you have been up to a lot of stuff over the last couple of years. You've been getting your PhD, I think it was. Tell us what you've been up to.
Yeah. So when you first reached, because we've known each other for a while, but when you first reached out to me, when I couldn't join you, it's because I was probably, I think at that time, finishing my PhD, and it's in clinical psychology, which means I would have been in my internship year, which is a full-time placement where you're doing the work of a psychologist, but you're doing it under a psychologist's license because you don't yet have your doctorate and you're not yet licensed. So
Ah,
I would have been in my internship year and also defending my dissertation at the same time. They really like to stick it to you with a PhD in psychology.
that
And
is
then
pretty
after
amazing.
that, yeah, it's a lot. And then after that, I would have been completing a postdoc or a fellowship. Different places use different terminology. And as soon as I finished that, which was this last March, then it was the process of getting my license. So going
Ah,
through steps to take the exams that are necessary to submit all of the paperwork. And so now I'm in this funny place where I'm waiting to start my new job. I'm going through the credentialing process at the hospital
mhm.
where I will be coming on as a licensed, finally, clinical psychologist
That's amazing.
working in a cancer center.
That is so
Yeah.
amazing. And I've been listening to you. You're one of the rogues on the Skeptic's Guide to the Universe. I
Yep. There's that
really,
too. Yeah.
yeah. And you've been on there for like over a decade now.
Yeah, I've been doing my show. I've been doing Talk Nerdy, which is my podcast, for 1 year longer. And I think we're in our 11th, maybe even into our 12th year now for Talk
Wow.
Nerdy. So we at 11 or close to 11 for SGU.
So I'm going to be including links, of course, in the description for both of these podcasts. They are fantastic. In fact, I've been listening to the SGU since I'm thinking around 2010.
Mm-hmm.
And I started listening to
They've been around
your,
since 2004. They are like one of
yeah,
the podcasts.
yeah. So I'd been listening to a lot of their stuff and catching up on it over the years. And it was so amazing. I met you, I met Evan, I met Jay. So it's been an absolutely, this last Psychon that I came to was fantastic. And I think it's probably one of the last that ever will happen, and definitely one of the last that I'll ever attend. There's a lot of
Yeah.
controversy over there, of course, because of
Yeah, we'll see what happens there. Oh, and I misspoke before. They started in 2005, but still one of the
close
earliest.
enough. Yeah,
It's 2025 now. They've been on the air for 20 years.
it's
Amazing.
insane. Absolutely
Mm-hmm.
amazing. And the thing is, I have been really going in depth into the topic of mental health because
Mm-hmm.
a couple of years ago, I think in 2023, I got diagnosed with ADHD, and I'm like 40, I was 43 at the time. And it blew my mind. It completely changed my entire perspective on life. And with that profound realization came a passion for kind of looking into mental health care and seeing how it's being addressed. In India, it is an absolutely abysmal situation. There's nowhere close to enough care for the population that we have, which is significant. It's over almost 1.5 billion people now. And I've, of course, I've been wanting to talk to you as a skeptic in general because you've been a science communicator for most of your career, and I'm just starting out. But I really wanted to get into the mental health side of things with you a couple of weeks ago. And in the last episode of my podcast, I interviewed Jonathan Steyer from
Oh,
Calgary.
yeah.
And so have you met him or worked with him or anything of
Yeah,
that
yeah,
sort?
yeah. And I think did he write probably a blurb for the book that I co-edited with Stephen Hupp? I know that they work together
Ah,
quite a
yes.
lot. And I may have done a blurb on Jonathan's book too. I can't remember.
Yes.
But yeah,
Yeah,
we
I
have
did.
run in similar professional circles for sure.
Yeah. So that was a fantastic conversation that he had. So I want to lead off from there. And it doesn't matter that you haven't listened to it. It's fine.
Yeah.
But he was I had a fantastic conversation. And I'm listening to his audiobook right now, actually, as I'm driving into the mountains.
Mm.
So I wanted to start off with, first of all, yeah, I've been looking at a summarization of your book in a way, thanks to ChatGPT. It's not
Hmm.
plagiarism if it's ChatGPT. So there's a term that he used called brain spotting. What exactly is that?
Ooh, you're gonna have to bear with. When do they
Hmm.
talk about brain spotting?
I don't have much context because I was looking at a
And you're talking
summarization.
about here in the pseudoscience book?
Yes, in the pseudoscience and in
Yeah,
therapy.
that's a tough one because just to clarify, so Stephen Hupp, who is a psychologist, and
Mhm.
we co-edited this book, meaning
Oh.
that we invited a bunch of subject matter
Hmm.
experts to write chapters for each of their different areas. And then we
Okay.
went through and clarified things, cleaned them up, and put them together in a volume that we thought would make sense. And the way that we chose to do the sort of order of the chapters
Hmm.
it tracks a little bit with the DSM. So we were interested in talking about different kind of clusters of diagnoses. So there's a depression chapter, there's a bipolar chapter, there's an obsessions and compulsions chapter, a chapter on
Hmm.
pain, a chapter on trauma, a chapter on sleep disorders, personality, tics, inattention, and hyperactivity. So there's a whole chapter right there for you. But I wrote the intro chapter called Thinking Critically About Therapy. And I think
Ah.
Stephen might have done, yeah, he did a postscript that includes skepticism resources. But I can also do a quick search. We can rely on the internet webs.
Ah.
Let's see.
And
So,
while you're looking that up, I always plug this whenever I possibly can. I wrote a book a couple of years ago. Ghost wrote, though.
mm,
It's under somebody else's name. It's on Amazon called, what was it? In Your Corner. So it was
ooh,
basically, it's 10 short stories that I wrote on teenagers who have been going through mental health difficulties and issues like depression, ADHD, obsessive compulsive, and a variety of others, including anxiety, self harm, and stuff like that. And did a lot of research and also got a lot of, tried to bust as many myths as possible in the process of doing that. But it was so insightful, and the research just completely fired me up. So this all kind of started around 2023 when I was getting into this stuff.
I
Any
love
luck?
it. Yeah, so brain spotting. See, this is why, like, when it comes to pseudoscience, everything is repackaged. Some new person will quote discover it or quote invent it, and then they'll slap a trademark on it and then make a bunch of money. So
Ah,
this is a pseudoscience that was promoted by a psychotherapist named David Grand, and he was engaging in EMDR, which is problematic in its own right. And when he was engaging in that EMDR, he claimed that the patient that was doing the EMDR, when they were moving their eyes back and forth, they would stick their eyes in one location. And
oh,
so he asked that patient to just keep her gaze there. And in doing so, helped her to quote, release her trauma. And then later she was like, I don't know, better at sports or something like that.
oh,
And so,
what is EMDR?
yeah,
Yeah.
EMDR. Oh, yeah. So that's a whole other thing. So EMDR is eye movement desensitization and reprocessing. And the frustrating thing about EMDR is that it is considered a evidence-based therapy by the American Psychological Association, which means that very often people can go to a psychologist or a psychotherapist and they can engage in EMDR, usually for post-traumatic stress disorder, but now it's used for other things. And their insurance might pay for it, or they may not understand or know that really there's very low quality evidence. So this is a situation where, yes, EMDR has been tested, but it hasn't really been tested against the standard of care. It's only been tested in and of itself. And there's actually, we have a whole chapter on EMDR in the book. I'm just going to find the author here. Okay, so Gerald Rosen, along with I think some of his graduate students, wrote this chapter on trauma and writes at length about EMDR because it's like a hot trauma therapy. And in EMDR, basically, he calls it a purple hat therapy. Let me see if I
I've
can.
heard of those, yeah.
You've heard of it. Okay, yeah. So the idea would be, let's say that you were, and this is not the therapy, this is an analogy. Let's say that you were really afraid of driving over a bridge. Like you had a pretty intense phobia that anytime you drove on a bridge, like over water, that the bridge was going to break and you were going to fall in. And so I worked with you at length, doing all sorts of evidence-based therapeutic techniques to get you to a place where you started to feel more and more comfortable driving over a bridge. And eventually you were able to do it without your anxiety going through the roof. And then let's say I handed you a purple hat and I said, if you wear this purple hat, you'll be safe when you go over the bridge. And then you drove over the bridge and you were safe. EMDR is like saying that the purple hat is the reason that you went over the bridge without anxiety and not all of the therapy that you did. Because very often, or I should say all the time, when people engage in eye movement desensitization and reprocessing, they're moving their eyes back and forth, but they're doing it while they're engaging in trauma-informed therapy.
Okay.
And so the claim is that moving your eyes helps the brain process these memories and reduce their emotional intensity.
Oh, wow.
But really, any form of distraction might help you be able to talk about something really difficult without focusing all of your energy and attention on it. And there's nothing special about moving your eyes back and forth really quick. That's the purple hat. But we should call it the main ingredient, right? The thing that is actually helping people who engage in EMDR therapy is the therapy itself. It's talking about their trauma with their psychotherapist and learning how to talk about it without re-experiencing it.
So in a way, it's like giving a homeopathic medicine along with a real medicine.
Exactly.
And saying that the homeopathic medicine is working.
Yeah. And I think that's why it's been so hard to tease it apart. It's been not that it's been hard to debunk. It is pretty well debunked, but I think the reason it sticks around so much is because if somebody was getting better with their real medicine and they were also doing their homeopathy, they very often might fall into some cognitive biases that tell them, oh, just to be safe, I should keep doing this.
Absolutely.
And I think that's the real problem, right? It's when people take the real medicine, but then they also do the folk remedies, and then they give all of the credit to the folk remedy when really it was the medicine that helped them.
Absolutely. I have plenty of family members and friends who swear by homeopathy, even though they've been taking the regular medication or the regular therapy or whatever it is that they've been going through. They always give all the credit to the alternative medicine somehow, and they swear that it works. It's quite interesting, and that it's
I see this a lot too. Yeah, it does, and I see it a lot too with things that resolve on their own. Like my favorite example is a sty. So it's like a little pimple almost on your eyelid.
Yeah.
And when people get styes, there are all sorts of folk remedies, right? Put a tea bag on it, put a gold ring over your eye. And when you ask people, what does that do? Like, why would you do that? They're like, I swear, I had a sty, I put a tea bag over it, and in 5, 6 days, it was gone. And I'm like, yeah, because that's how long it takes for one to just go away on its own.
Exactly. It's like the whole cold thing. If you don't take medicine, it might take 7 days to go away, but you take a medication, it'll just take a week.
That's so good. But so back to brain spotting.
Hmm.
So apparently this is just like an even narrower focus. So I found a good quote online actually in a science-based medicine article that Steve Novella wrote earlier this year.
Yeah.
Brain spotting makes use of this natural phenomenon through its use of relevant eye positions. This
Hmm.
helps the brain spotting therapist locate, focus, process, and release a wide range of emotionally and bodily based conditions. Brain spotting is also a brain based tool to support the therapy relationship. We believe that brain spotting taps into and harnesses the body's natural self scanning, self healing ability. When a brain spot is stimulated, the deep brain appears to reflexively signal the therapist that the source of the problem has been found. But here's the thing, when you just stare into a particular direction, there's no anatomical link between your eye gaze and like some part of your brain where
Yeah,
trauma is low. This is like phrenology.
exactly. And it sounds for people like us, and I mean, you especially, you've been in the skeptical movement for a very long period of time. We can tell these little terms that they use that put up
Mhm.
little red flags. I don't know. I can't exactly spot it. It's so subliminal now that I'm
Yeah.
trying to figure out what exactly were the words were. But yeah, it doesn't sound like it's really a real thing, but I can understand why people would be drawn into it and to be actually giving it some form of credit for working or at least
Yeah.
wanting to try it out.
Yeah, it uses all the right words. It talks about neural processing and plasticity. And sometimes it's hard for people to accept that when we're dealing with mental health issues, there are some diagnoses for which medication is a boon, right? For which
Yeah.
medication can be night or day for some patients. I myself have been diagnosed with earlier on major depressive disorder, but more likely persistent depressive disorder. I think that's a better fit for my diagnosis now, which would what used to be called dysthymia. And I take Prozac every day. And before I took Prozac, I just white knuckled this. And after Prozac, it's incredibly different. My depression is really well managed. That said, I still speak to a therapist and I myself am always working to learn my own tools. I am a therapist now as well, but
Yeah.
therapists need therapists too. And so I'm
Absolutely.
often working yeah, on developing my own tools to help manage my depression and to help with emotion regulation and with coping. And I think it's hard for a lot of people to accept that talking to somebody in and of itself and engaging in evidence-based therapeutic approaches is incredibly healing. There are a lot of tools that we can learn, and we can learn them by talking, we can learn them by listening, we can learn them by doing homework, engaging in different sort of cognitive behavioral approaches. I think a lot of times people want there to be a quick fix or they want there to be a sheen to the therapy, right? Like a
Yeah.
program that you can pay for or kind of fancy words that make it sound more legitimate.
Mhm.
When actually the irony is that those drummed up and fancy approaches that sound really legitimate are often less legitimate than the ones that
Yeah.
don't require all the verbiage.
Yeah, exactly. And but speaking of talk therapy and psychotherapy, what are so I was speaking to Jonathan Steyer and we were discussing all the things in the wellness industry which try to hijack mental health issues and try and
Mm-hmm.
get patients away from therapy and into their industry. But I was wondering, is there, and since I haven't read your book because I have ADHD, sorry, I was wondering, like, are there these any forms of pseudoscience that are prevalent while a therapist is between the therapist and the patient?
Yeah, I think EMDR is a great example. It's
Hmm.
accepted by the APA. A lot of trauma-informed therapists use EMDR, but it's a problematic approach because it doesn't work. And most of the studies that show that it does work are low quality studies where they don't
Hmm.
have control. Now, that opens up another conversation about how we test mental health treatments. A lot of people expect mental health treatment science to be as robust as like drug trials, and it's very hard to do that. So you often end up with gold standard treatments in psychology or in the mental health field being the treatments that just happen to be the easiest ones to test. So there
Okay.
is a lot between the therapist and the client that is both art and science. And I often hear physicians say the same thing. Like medicine, very similar to psychotherapy, is evidence based, right? If you're going to be dispensing a medication, you're going to want to make sure that the dosages are within the appropriate range for your patients, that the drug interactions have been well researched and vetted, and that you're treating a appropriate, let's say, disorder or diagnosis based on the symptoms that tell you that you have that diagnosis, right? And all those things are similar in psychotherapy as well. But then there is the art component, right? Some people react differently to different drugs. Or do I want to start this person on a lower dose and ramp up? Or is this person, based on these things that they're telling me, is their fear going to get in the way? Are they treatment resistant? Are they good about taking their medications all the time? And so it's the same thing with therapy. Some patients aren't ready to dive into certain approaches right at the beginning. Some patients require a lot more validation than other patients. But there are some central ingredients that pretty much all therapists agree is necessary for bona fide psychotherapy to work. And there are ethical principles that guide that as well.
Yeah.
Whether somebody is using pseudoscience within the therapeutic context, I'm sure it happens all the time. And sadly, because psychotherapy is different than psychopharmacy, right?
Mhm.
It is talk therapy. There's a lot more like room for that, a lot more latitude.
Yeah. So, like, I've heard about, and a lot of these things being seriously discussed. For
Mhm.
example, let's do a quick rapid fire round, and then we could dive a little deeper into each one of these if necessary. I'm just going to name a few of these interventions, and you can let me know if
Okay.
they're fake or real. We can do like a
Oh
science or
gosh, we'll see
fiction
if I
kind
even
of thing.
know. Yeah.
All right, hypnosis.
Oh, hypnosis is fake. I think there are aspects of relaxation therapy that are real, but
Mhm.
hypnosis, the way that you and I would think of it, like you're getting very sleepy and now you're going to bark like a dog. Yeah, that's totally fake.
But there's a lot of hypnosis that's used to combat addiction behavior and addiction disorders, etc.
Yeah, I
Does that have
sometimes
any water?
wish that there was another term that some of those practitioners would use, right? Like relaxation therapy for addiction.
Mm,
Because I think if there's a claim that somebody is getting into your subconscious and helping you or causing you to no longer be a smoker because they're sending you subliminal messages, that's abject pseudoscience.
ah,
But there is some pretty good evidence that whether we're talking about mindfulness meditation or just relaxation, can
mhm,
be exceedingly beneficial for emotion regulation and for helping people combat things like cravings and for
mhm,
helping people gain insight into why they choose the behaviors that they choose. So, depending on the addiction, whether there's a strong physiologic addiction or whether the addiction has more psychological components, I think some people could quit, let's say smoking, for example, if they engage in relaxation therapy with a psychotherapist that helps them dig deep into why they're still smoking when they don't want to be. But no, you're not going to be in some half awake state where I send you subliminal messages and move a clock in front of your eyes, and when you
you
wake up you just won't
will
have
not smoke
cravings anymore.
anymore.
Yeah, that's not real.
All right. Okay. And that leads into my next one, which is meditation.
Yeah, so meditation is a tough one. Like you might hear on on the Skeptic's Guide podcast, you might hear Steve and I wouldn't say like butt heads over meditation, but have very nuanced conversations about meditation. I think part of the problem with meditation is that it's just a broad term and it's not a regulated term. And so there are mindfulness based meditation techniques that are utilized in psychotherapy, and different, I don't want to get ahead of myself, but different orientations of psychotherapy claim them differently. So cognitive behavioral therapists might say, we developed mindfulness based meditation. Like existentialists will be like, we use it all the time. And depending on how it's done and depending on the desired outcomes, it can be incredibly beneficial. And there are actually good quality studies showing positive outcomes with very narrow focuses of mindfulness based meditation. The neuroscience is actually really interesting because it does seem to quiet the default mode network, which is a neuronal network that is activated when our minds wander. And so expert meditators or people who have been meditating for a very long time, but especially I'm talking mindfulness-based meditation, not like transcendental or any of these other types, but people who engage in mindfulness-based meditation regularly in an fMRI scanner, their default mode networks are much quieter, and they can also quiet them much more quickly. And so that shows that they are less apt to distraction and to mind wandering. They're able to bring in their focus more quickly. Now, that's a really interesting finding, right? Does that mean that if you meditate, it's going to help you with your trauma? Not necessarily. And actually, I find that mindfulness-based meditation that focuses on the breath is deeply calming for me. But I have friends and patients who have anxiety, and when they feel panicky, their breath becomes a trigger point for them. Thinking about their breathing makes them panic more. And so I would never recommend engaging in that type of meditation for somebody who is triggered by focusing on their breath.
Yeah, I remember one of the conversations that was happening on the SGU, where I think Stephen said it was like meditation is anything that you're doing with attention focusing on one thing. So it could be gaming,
right?
It could be reading, it could be some certain forms of exercise as well, which could be meditative in their effect.
And
So do you think
yeah,
that's
and he
true?
often will. No, I don't. I think that can be meditative. But again, I disagree with him, but I also agree with him because it's the definitions are wiggly. This is an operational definition problem. Yes, I think gaming can be meditative. Yes, I think that coloring can be meditative. And I think that all of those things can be deeply beneficial. I find that I love knitting. It helps me focus on something and it gives my hands something to do. And I find it's very good for anxiety reduction for me. And a lot of people will say that they like to engage in very focused activities for that reason. I think that one of the active ingredients in mindfulness-based meditation, which is not elicited in, let's say, gaming or even knitting, is the intentionality that comes when you recognize that your mind has started to wander and you bring it back to your anchor point. And that's the practice of mindfulness-based meditation. It's sitting quietly, thinking about your breathing in and out, or thinking about a tone, a bell, whatever it is, it's having an anchor point. And then doing what human beings do, which is your mind starts to wander. It always happens, right?
Yeah, exactly.
The goal is to not think. The goal is to recognize when you start thinking about other things and redirect your attention back. And then it's going to happen again and you redirect it back. And that's a very specific practice that's not elicited in those other approaches. And that's why I disagree with him as well when he says a lot of the studies show that it's no different than just relaxation. And it's, yes, that is true, but you have to ask yourself, what are the independent and what are the dependent variables in those studies? A lot of people are going to feel calmer after any type of relaxation experience, whether it's mindfulness-based meditation or sitting in a quiet room or getting a massage or listening to soothing music. Yeah, it's going to help all of us down, and it might help us with our anxiety, and the numbers might look the same. But when we're specifically looking for the outcomes that come from mindfulness based meditation, very often it has more to do with attention and regulation. And that comes from that redirection. So, in that one narrow way, I do think that mindfulness based meditation is different from what we might just generically call meditating.
That is very interesting. In fact, I first understood meditation thanks to Sam Harris in his book Waking Up.
Yeah.
And he actually, as a part of the promotion for the book, he released two MP3 files of him guiding you through a meditation. One, I think, was like
Yeah.
9 minutes long, one was about 20 minutes long. And I used those to meditate, and it
Mhm.
helped me tremendously. So when my
Yeah.
therapist started telling me
Yeah.
to start meditating, I was like, yeah, I can do that. And now I find that I don't meditate all the time, but I find that when I'm having trouble getting to sleep, that if I listen to, I first try my breath. And if that
Mhm.
doesn't work, I use white noise as the
Mhm.
anchor point,
Yeah.
and I'm out in 5 minutes.
That's great. Yeah. It is important, I think, for a lot of people when they first start engaging in mindfulness meditation, listening to a guided practice can be really helpful.
Yeah.
And then the hope would be that eventually you might be able to get to an unguided practice where you are just focusing on the breath within a certain amount of time. But really, anything that I keep mentioning the breath, that's not the only way to meditate. Basically, anything that involves focusing on the present moment and not
Mm,
judging yourself, right? Being very aware of right now. And every time your brain does what it tends to do, which is wander and think about other things, bringing it back to the present, whatever your anchor point is in the present, and doing it in a really non judgmental, like kind way. It's an
mhm.
important practice because it translates to so many other aspects of self care, of being kind to yourself and
Oh,
being able to be present. Because for many people, when they're struggling with anxiety and depression and some of the other types of symptoms of mental illness that are not in what we would call the severe mental illness kind of bracket, like non-psychotic mental illnesses. Very often when we're dealing with depression, anxiety, even trauma, what's happening is that we're having a hard time staying present in the moment, and we're either ruminating about the past, we're replaying things that happened, go, why did I say that? Oh my God, I sounded so stupid when I did that. Oh, if only I had done something differently, if only I'd made a different choice. Or we are catastrophizing about the future. Oh my God,
yeah.
this thing's coming up. Am I going to be ready? How am I ever going to get through this? This is going to be so overwhelming. And when we can get
Like
back
how I
to,
was preparing for this interview.
yes, again, this is a normal human experience, but for folks who struggle with anxiety or depression, sometimes that's turned up to 11 and it becomes so debilitating that it interferes with their everyday lives. It interferes with
Mhm.
your ability to maintain a healthy relationship or to get through your work or your school. Maybe it gets in the way of you sleeping at night. There are a lot of different ways to like qualify for those diagnoses, but I don't like the word qualify, but like to check the
Yeah.
boxes and how we diagnose. And mindfulness meditation can be a huge part of helping people manage their anxiety and their depression symptoms.
This kind of leads into another thing I wanted to talk to you about, which is I was talking to a friend of mine the other day, and we've spoken about therapy. She and we've spoken about therapy and going to therapy for a variety of different things. And she told me that she kept mentioning that it there was another word that she used along with therapist, and I think she mentioned energy therapist or spiritual
Ooh,
therapist or something of that sort.
that sounds intense.
I know. So I dug deep into that a couple of days
Mhm.
ago because I wanted to understand her perspective before I spoke to you about this. And it was very interesting. She actually goes to a person who she does breath work with.
Mhm.
And along with the breath work, there is a long conversation that happens. And she counts that as therapy. Now,
Mhm.
firstly, I want to understand, have you explored at all the implications of breath work in mental health and therapy?
No, not in a like a super deep dive way, but I think one of the things, like I think there are two things implicit in this, I don't know, question or in this discussion. And one of them is like, what is the breath work? What does that actually do? Is it evidence-based? Is it something that is pseudoscientific, or is it an appropriate treatment for something? The
Yeah.
other is this word therapy. The word therapy is not a regulated term. It's a
Mhm.
very loose, like chemotherapy is a type of therapy.
Yeah.
Psychotherapy is a type of therapy, and perhaps energy therapy is a type of therapy. All a therapy is a quote treatment, right? That's intended to heal something or relieve something or make you feel better. So, massage therapy is a type of therapy. But very often, if I'm going to go to a spa to get a massage, I have no expectation that massage is going to heal a mental or physical disorder or injury that I have. I'm
Mhm.
going there for relaxation, for what I my form of self-care, because it makes me feel good. There's
Mhm.
nothing wrong with that. The thing where things get dangerous is when people promote different types of therapies as bona fide or evidence-based medical or psychological treatments.
Yeah.
And breath work therapy or energy therapy or Reiki therapy or anything within that bubble is not a bona fide psychotherapeutic treatment.
So,
I've never learned about it in
mhm.
school. It's not listed on any of the organization's evidence-based treatments list. It doesn't seem to have a mechanism of action. That said, learning how to breathe and focusing on your breath in meditation can be beneficial. Definitely when I work with folks who have panic disorder. So they have anxiety with panic attacks, and they're so afraid of having more panic attacks that it actually makes their anxiety worse. Learning how to breathe is hugely beneficial, right? I do teach breathing techniques. How do you bring your breath low into your belly, diaphragmatic breathing? So you're not breathing shallow in your chest and blowing off too much carbon dioxide and basically alkalizing your blood and making you really lightheaded. We don't want that when we're feeling anxious. So I do help people learn how to breathe in such a way that it doesn't spin their anxiety out of control. But I think that's really different than what most people are claiming when they talk about doing, quote, breath work.
Yeah, because this comes with a term like spiritual response therapy,
Yeah.
which kind
Yeah.
of,
The minute you start getting into the metaphysical, it like it can't be scientific anymore
mm,
because by definition, things that are metaphysical don't exist in the natural world, which means we can't use the tools of the natural world to study them. So it's not science anymore. It is a
yeah.
form of pseudoscience. Now, when I say something is a form of pseudoscience, that doesn't necessarily mean that it's not beneficial in some form or another. Pseudoscience just means, at least the way I use it, that it has been proven not to work. And those are the things that we love to focus on books like this one, because why would you engage in something if we've done the research and we know it just doesn't work? But it
Mm,
also includes a kind of category of things that have not been proven to work. And that's two different things, right? If we've proven that something doesn't work, it's very different than we just haven't proven that it does work. And some of those
yeah.
things are because they're unethical or difficult to test, and others are because they're not testable. And it's not testable whether you are actually, I don't know, communing with spirits when you close your eyes. I can't
Yeah.
test that. By definition, that's I can't do science with that. So I'm never going to be able to talk about it scientifically. And for me, I am an evidence-based practitioner. I'm not interested in engaging with my patients and things that are outside of the realm of what I would consider like reasonable approaches to mental health treatment.
Because, and I was wondering, the thing is, the mind, even though I think of the mind as a part of the brain, emergent property of the brain,
Yeah.
and I feel that, but I feel that the differences between physical health and
Mhm.
ailments is fundamentally different for mental ailments in the manner that there can be a lot of placebo-like effects that can actually be effective in helping regulate someone's mood. For example, with this friend of mine who is going for this breath work and doing spiritual response therapy, and she goes for foot reflexology, which is like an acupressure thing. I wonder if those things, even if they are no better than placebo, but they are relaxing, would that be would you count that as still beneficial in some way for their
It
mental
may
health?
be it may be beneficial for her mental health. And I think that's why there's a big difference between talking about mental health and talking about mental illness, right? If somebody is feeling stressed, run down, if they're having a hard time grappling with a decision that they might be making about work or about their family, and then they want to engage in spiritual practices, yeah, that could be great for their mental health. Is
Mm,
it going to treat a mental illness? Probably not. It may
mm,
be adjunctive, it may be something that helps them holistically feel more well rounded, feel better about themselves. It may bring them community, it may bring them a sense of purpose. All of those things can promote mental health. But I guess I would encourage a conversation around what a placebo actually is, because I do think that we misuse the term placebo a lot. We love to throw around the term placebo effect, but there actually is no such thing as a placebo effect. What there are specific effects and non-specific effects.
mm.
Anytime a treatment is given, there are aspects, statistically, there are aspects of the outcome variable that are explained by the manipulated variable. So I give you a drug, you get better. It's very likely that some percentage of your betterness can be explained by the drug I gave you, but it's not going to be 100%.
Ah,
Some percentage is going to be the fact that you came to the doctor to get that drug
mm,
and that you got up off your ass and got in the car and you drove and that you saw other people and you spoke to people and you smiled and you shook a hand and you maybe started to feel motivated to do other things to improve your health and wellness. The drug would account for quite a bit of that variance, but there will always be a percentage that is not explained by the drug itself. We don't
ah.
always have the tools to divvy up all that variance and say 1% is from the twinkle in the doctor's eye and 3% is from the sun shining that day. We can't measure that. When it
Unless
comes
you're
to
sunning your perineum.
there you go. Don't do that. That is pseudoscience for sure. But when it comes to mental health, the variance is usually a smaller portion that can be explained by the psychotherapeutic treatment because it's not drug therapy, right? And it's not as straightforward. But there's always some variance, which is why when you take group A and you give them the treatment, and you take group B and you give them the same treatment but without the active ingredient, a certain percentage of group B feels better. Now, a lot of people try to say that's the placebo effect. That's you willing yourself to be better.
Yeah.
I think it's better to think about it. That is all of the non-specific effects at work. We
Mm.
just don't necessarily know how to measure them or even put a name to them sometimes. But
So
it's
we
all those
just
same things I mentioned. Being enrolled in a study, having hope, showing up, doing all of, maybe you're eating a little bit better. Maybe you're going to sleep earlier at night because you want to make sure you're refreshed for when you go in for that appointment. There are all sorts of non-specific effects that could be
mm,
contributing to your health and wellness. But I think this is one of the best ways to think about it from an ethical perspective. It is illegal and highly unethical to give somebody a quote placebo and not tell them, because by
oh,
definition, a placebo, or maybe we'll call it a sugar pill, is a quote unquote drug that doesn't have the active ingredient in it. So by definition, we know it doesn't work. So if you
Yeah.
gave that to somebody and said, you're taking a drug that's going to make you feel better, and then they started to feel better, we know it's because of the non-specific effects. And it's actually unethical to tell them it's because of a drug. We're actually withholding real medicine from them when we do that. And it's a huge no-no. It's why in
Well,
clinical trials, the people who are taking the placebo versus the people who are taking the active ingredient, they don't know who is who, and neither do the scientists or the physicians who are giving them the drugs, because they might act slightly differently and affect the outcome.
uh,
But we can't say you're getting the drug. That's
yeah.
highly unethical. All we can say is we don't know if this is the drug or the placebo.
Yeah, well, so in some countries, we are
Mhm.
now having a part of the government which is knowingly giving people the wrong treatments
Mm.
and expecting things to get better
Yeah.
in a
Yeah.
in a kind of a parallel way. So you've got RFK Jr. and we've got our Ministry of Ayush, which is
Mm.
basically a part of the government de devoted to promoting pseudoscientific treatments, including
Yeah.
naturopathy, yoga, Ayurveda, homeopathy, Unani, which is a Middle Eastern, it's not Middle Eastern, it's actually Greek, a Greek form of herbal medicine, and Siddh, which is a South Indian form of herbal medicine. Yeah.
Yeah. And isn't it amazing how much those actions by these individuals in power, on their surface, it can be a bit inscrutable. Why would they want to be promoting these treatments that we either know don't work or we don't have good enough evidence to show that they do work? Why would they be promoting this either instead of or sometimes parallel with evidence-based treatments? And
Mm,
I believe that a certain, maybe not, it maybe doesn't have all the explanatory power, but a fair amount of explanatory power comes from pure, unfettered nationalism. It comes from pride in one's nationalistic culture.
yeah.
And I think we see this both in the USA and we see this in India. We invented this thing. This is our way. We're going to do it different. And because we're doing it that way, we're doing it better. And I think you saw the same thing during the horrible era of Lysenkoism
Yeah.
in the former USSR.
Absolutely. Thousands of people dying. Was it thousands or, yeah, definitely thousands to tens of thousands.
At least, yeah, because it affected like food crop, like it affected so many things. Let's see how many people, I'm Googling this, or how many deaths is Lysenkoism responsible for?
And of course, it
That's
was,
probably pretty hard to measure. Obviously, anything's going to be an estimation there,
yeah.
but massive famine. Oh, some people are arguing the famines themselves, 7 million plus people.
Uh, my God.
And there were scientists that were executed. So there were like direct deaths, there were indirect deaths.
Oh,
Some people think 15 to 55 million people
mm.
starved in China. Yeah, it's pretty bad because
And
they adopt a lot of those same Lysenkoist policies. Actually, a lot of folks would argue that the Great Chinese Famine from 59 to 62 was due to Lysenko's policies.
my goodness. And more recently, there was this huge famine of sorts which happened in Sri Lanka. And in fact, I want to talk to Kevin Folter about that. And I first heard Kevin Folter on your show, Talk Nerdy,
Yeah.
which has got really got me intrigued. So I'm mailing him and we're in touch and trying to figure
Good.
out a
Yeah,
date.
he's a great interview and he is really knowledgeable because this is a guy who this is his research and he's in it all day every day.
Absolutely. It's absolutely fascinating. But unfortunately, we have run out of time. I had so much more to ask you
Sorry.
that we really need to do like a part two if you have the time. Because
Absolutely.
okay, one thing which I do want to touch on before we go, which personally I've been very intrigued about, is one is animal therapy and the other is music therapy. How do animals and music have beneficial effects on people who are going through stuff and who have mental health ailments?
And that's the thing again, where it's there's that art and there's that science. And I think
Mm,
where we get into trouble is when we try to take the art and push it into the science and do a one size fits all label for everybody. I've seen this when I am in an academic program, students really interested in engaging in studies around animal therapy, animal assisted therapy, or like music therapy or art therapy, for example. There's not very strong evidence that show that if I sat down with, I don't know, a piano and played music for every single person that came into my office who was struggling with OCD, that it would have any impact on their OCD. But I can damn well tell you that I have patients for whom music is exceedingly healing for them. And I have patients for whom music doesn't really do much. And I think that's the important thing to remember, that a lot of these things, which could be like adjuvants, like they can be additional benefits to individuals on top of their bona fide treatment, they're
mm,
great. But
yeah.
as a psychologist, I'm not going to be engaging. I might recommend you love music, music helps you relax. Do the things that you love. Engage with the things that make you feel calm, that give you a sense of purpose, that help you sleep at night, that promote all of the aspects of wellness that we know are going to improve your mental health overall. But I'm not going to write a one size fits all prescription and say everybody needs to go ride a horse today because riding a horse is going to help you with your autism. Like it just doesn't work that way. It
Yeah.
would be great if it did. And I think a lot of people promote it like it does work that way, but it just doesn't.
There you go. Because I've got 3 cats and I've got 5 bass
Mhm.
guitars, but I also go to therapy. I
Right.
also go to therapy and I have a psychiatrist. I'm on medication.
Yeah.
Don't forget those
Yeah.
parts.
Yeah. Don't just get yourself another base. Another cat is not going to fix all your problems.
That's what I
There's
keep
no
telling
dose
myself.
response curve there.
That's what I keep telling myself. But
Yeah.
thank you so much. This has been such an intriguing conversation. And honestly, this hour has just flown by. But
Absolutely.
we do have to cut it short. But I hopefully we can do a part 2 at some point of time, and we'll coordinate for that. In the meantime, thank you, Kara, so much for joining us on the Rationable Conversations.
Thanks so much for having me.
And thank you, everyone, for listening. If you like this conversation, please give it a do subscribe to this channel or this podcast. Rate it on an Apple on Apple Podcasts or on whatever platform you're listening to. And we are on Patreon at Rationable as well if you want to support the show in other ways. But thank you all for listening, and thank you so much, Kara, for joining us. Until next time, stay rationable.